My name is Cindy Brown, and this is my presentation on mentorship, a strategy to increase retention of healthcare systems. I am the author and researcher, Cindy Brown, and my DNP chair is Geraldine Franson. New graduate registered nurses experience a reality shock that can present with feelings of anxiety, lack of confidence, and being overwhelmed when transitioning from school to the workforce. Experiences of high stress and anxiety can lead nurses to leave the job within the first year, causing their facility thousands of dollars and decreasing the quality of patient care. To address this issue, a hospital located in the Midwest region of the United States implemented a mentorship program to improve the retention rates. Literature supports the implementation of mentorship programs, and studies have shown that they increase retention by 11 to 17%. This was a quality improvement project with a retrospective design. The main problem at hand is when the new graduate registered nurses come off their orientation or preceptorship and are on their own, they often experience a high stress environment, and thus the term reality shock comes into play. Healthcare facilities spend anywhere between $70,500 to $88,000 on each new graduate nurse that they hire. The literature mentioned that some facilities lose 35 to 60% of their new graduates within the first year. Of course, some are less than this as well. This costs the facility thousands, if not millions of dollars, depending on how big the facility is and how many new nurses they have hired. With poor rates of retention, facilities spend a lot of time and money training new nurses. This means there is a decreased experience in quality nursing occurring within the units, which means decreased quality patient overall. The methods that were used in this project was a quantitative exploratory study, and data was collected retrospectively using a post-intervention design. Data was collected using surveys that gathered the new graduate registered nurses' intent to stay employed after 1 year and after 2 years, and employment records from the new graduate registered nurses that were hired in 2019 and those that were hired in 2020. There was some qualitative data that was gathered from the open-ended questions that were included in the surveys. There were 7 females included and 1 male nurse that were enrolled in the mentorship program. There was overall 6 meetings that occurred over 9 months. The specific aims of the project: this project aimed to increase retention rates and nursing confidence. The project speaks to the Institute of Medicine, the IOM's, initiative to create residency programs and to improve education in order to meet the demands for the level of care required. The mentorship program included 5 of the 6 pillars of the IOM's report to work towards advancing education transformation, leveraging nursing leadership, removing barriers to practice and care, fostering interprofessional collaboration, promoting diversity, and bolstering the workforce. The only pillar it didn't quite speak to was promoting diversity. It also improved the new graduate registered nurses' skills and confidence, which will increase patient quality care and increase patient safety. Mentorship programs help to further improve their skills and confidence, which helps to decrease the likelihood of medical error. Progressing these elements of their development creates better patient outcomes and quality care. The mentor and mentee relationship also improves patient safety because it strengthens the nursing team in times of emergency. It also allows for the novice nurse to have someone to go to in times of uncertainty on the job without fear of being reprimanded. Mentorship programs hold a high level of importance when improving patient outcomes. Lastly, the program also gives experienced nurses leadership opportunities, allowing for significant growth within the practice. Leadership is needed in the role of advanced practicing nurse. As a nurse practitioner, one needs to be able to lead and motivate others. They can be a leader in their field of evidence-based practice and healthcare policy. Throughout this leadership experience, nurses are forming competent nurses who will be able to continue on their own educational journey and foster the possibility of earning an advanced degree as well. The PICO question that was used for this project: for the population were new graduate registered nurses on a pediatric medical floor. The intervention was the mentorship program, and it was compared to those that were retention rates from those prior to the implementation of the program compared to those after the implementation of the program. The outcome was in hopes of improving retention rates, and then lastly, the time frame was over a year. Mentorship programs improve nurses' confidence, competence, and feelings of belonging, and hopefully decrease stress and anxiety. For the design of this project took place in a Midwest hospital on a pediatric unit. There were 8 new graduate registered nurses that were enrolled in the program from the beginning. Only 5 of the 8 nurses completed the entire program. Intent to stay surveys were distributed at 6 months into the program and at the end of the program at 9 months. Employment records were gathered from a group of new graduate registered nurses that started in 2019 before the program was implemented. And then in 2020, the group that was involved in the mentorship program. In the graph below, you can see that of these 8 new graduate registered nurses, 87.5% were female and 12.5% were male. This equated to 7 females and 1 male. For the data collection tools, a literature review was conducted to construct the intent to stay surveys. 3 experts in education and management approved and determined that the surveys were appropriate. The other data collection tool were the employment records. The unit manager supplied the employment records and no identifiers were included. These data collection sheets were utilized based on extensive literature review to keep the information anonymous. For the analysis plan, data gathered were retention rates and the significance of mentorship programs influencing these retention rates. The data analyzed within this study occurred using Excel to run descriptive statistics. Most of the statistics were nominal data and descriptive statistics were presented in percentages. There was a group of those still employed after a year and those that were not. There were those who intended to stay and intended to leave the unit within the intent to stay surveys. With the nominal data, the mode and mean of the 2 options were collected. Median was not included. The intent to stay surveys collected at 6 months of employment and at 9 months of employment were compared in the same manner. The statistician at Maryville was advised when discussing the descriptive statistics that were used within the study. Although most of the data of the design was quantitative, there was qualitative data gathered in the surveys from the open-ended questions that were included. There weren't quite enough surveys. There was 11 in total, and there wasn't enough themes to be able to be derived from each of the surveys. For the results, there were 2 main results of the study. Overall, there was a 7.5% decrease in retention after the implementation of the mentorship program. This was obviously not in the intended outcome of the program, so later I will discuss the possible factors that contributed to this outcome. The other result of this project was when analyzing the data from the intent to stay surveys, there was minimal change from the first survey to the second survey. The intent to stay survey showed that there wasn't a significant improvement in the satisfaction with work environment, support from other coworkers, or intent to stay employed after the first year. In the next two slides, I will discuss these outcomes further. There was some qualitative data gathered from the open-ended questions in the surveys that showed that overall the mentorship program helped improve their hands-on skills. Below in the graph is a visual representation of the intent to stay surveys and how the average answer changed from 6 months to 9 months. For the retention data table, employment records were gathered from the new graduate nurses who started in 2019 compared to those who started in 2020. The group that started in 2020 were those that participated in the mentorship program. From this table, we can see that there were 10 nurses who started in 2019, and 7 of those 10 were left after the first year of employment. The retention rate for this cohort of nurses in 2019 was 70%. In 2020, there were 8 nurses hired in July and only 5 nurses left at the end of the year at their 1-year mark of employment. Retention rate for this cohort of nurses in 2020 was 62.5. This is a 7.5% decrease from the group in 2019 compared to the group in 2020 after the implementation of the mentorship program. This table shows the results of the intent to stay surveys. The surveys were given out at 6 months and at 9 months, and there were 4 questions asked in each survey, same questions at 6 months and at 9 months. At 6 months, there were only 6 new graduate registered nurses in the program, and at 9 months, there were 5 left in the program. Answers to the questions at 6 months were compared to the answers at 9 months. Each question in the survey was answered on a scale from 1 to 5. In this table that you see, the mean answer was calculated from each participant, and survey 1 was compared to survey 2. Question 1 asked, how satisfied are you with your current work environment? 1 was not satisfied at all, whereas 5 was completely satisfied. You can see from the results that there is a slight decrease in satisfaction with the work environment. This is likely due to the environment of the pandemic, which I'll discuss further later. Question 2 asked, how well do you feel supported by your managers, supervisors, and other staff nurses? In the results, you can see there wasn't much of a change at 6 months compared to 9 months. Again, due to COVID, nurse-to-patient ratios were going up, and I think overall there was less support as there was also short staffing. So I believe this contributed to these results as well. Question 3 asked, how likely are you to stay in your current position after the first year? In the results, you can see that there is a very slight decrease at 9 months. And lastly, question 4 asked, how likely are you to stay in your current position after 2 years? There was no change from 6 months to the 9 months. For the discussion, although increased retention was not attained, there was a significant amount of positive feedback given from the new graduate registered nurses who were involved in the mentorship program. This came from the unit manager and from the open-ended questions in the survey. The strength of this project was the positive feedback it received, and the time allowed to collect the data, and the fact that the program was able to run for a full year. The weaknesses of this program, unfortunately, it did not get the desired outcome of increased retention. and that was thought to mostly be due to COVID-19. It also didn't have as much one-to-one mentorship, which is more supported in the literature. There was group meetings monthly, or 6 out of the 9 months, but the one-to-one mentorship wasn't as strong as it should have been or could have been and may have produced some better results. Much of these results are thought to be due to COVID-19 and the high stress environment it created for the new graduate registered nurses, as well as all the nurses, even experienced nurses. An article mentioned that nurses' intent to leave their job was higher when they had been taking care of COVID-19 patients. The particular unit that this program took place on was a COVID-19 unit. The pandemic added additional stress due to an increase in nurse-to-patient ratios, having to care for COVID-19 patients, having to float to other units that were short-staffed, and a constant change to the daily workflow. It is possible that a loss of retention would have been greater than the 7.5% we saw in the study had the mentorship program not been implemented. The future of nursing is in a vulnerable position in the wake of COVID-19 as shortages have grown to new heights. Further research and measures to improve retention are needed to restore the field of nursing. The nurses that received education during COVID-19 are at a disadvantage due to the difficulty in fulfilling all required clinical hours. This reiterates the importance of these types of programs. I spoke a little bit to the implementations for the future in that last slide. Since its onset in 2020, COVID-19 caused increased stress and anxiety for many nurses who were directly working with COVID-19 patients. This included the nurses that were enrolled in mentorship programs that took place in 2020 to 2021. As mentioned already, there was a study that found that nurses' intent to leave the job was higher when they had been taking care of COVID-19 patients. It is now more than ever that the field of nursing needs programs like this to improve retention throughout healthcare facilities. Many new graduate registered nurses still feel unprepared after their preceptor period is over and they are on their own. This program works at improving retention and making the transition from a novice nurse as a new grad to a more experienced nurse more manageable. There were many nursing students whose education and clinical rotations were greatly hindered by the pandemic, so this only makes these programs even more important to further help them develop their skills and their confidence. Even though this particular program did not have the expected outcome, there is a possibility that retention could have been even worse throughout and after COVID-19 had this program not been implemented. Implications for healthcare policy. As I mentioned earlier, this project spoke to the Institute of Medicine's initiative to create residency programs and improve education in order to meet the demands and the level of care required. It also speaks to the Affordable Care Act to perform higher quality and safe care. After completing the first few months of the preceptorship as a new graduate registered nurse, they are still very much novice nurses. Mentorship programs help to continue their education to make for a more prepared nurse, ultimately providing a higher quality of care. These types of programs have a significant place in healthcare as they are needed for quality and safe care and how all of the patient population keeps aging, and we're going to need a lot more nurses who are confident and skilled. In conclusion, although this program did not show that there was an improvement in retention, there is strong evidence in literature that they are of benefit. Many facilities have implemented residency programs as advised by the Institute of Medicine. However, mentorship programs create the opportunity for a better teamwork and skill development at a closer level. It's taking it from as a hospital-wide program to a local level on their actual units and with their coworkers and experienced nurses on their floor. The positive feedback that was received by the unit manager and in the final surveys implicated that the mentorship program that took place within the new graduate registered nurses home unit was more beneficial than the hospital-wide program. It would be of benefit for healthcare systems to move to this more localized approach and to be able to tailor the information to the new graduate registered nurses' needs. As discussed earlier, COVID-19 has created nursing shortages due to nurses retiring earlier and high nursing burnout rates. And nurses that received education during COVID-19 had many other disadvantages. This makes it all the more important to have programs like this that help increase skill development and confidence and hopefully increase retention rates. These are my references. And this is my contact information if you have any questions. Thank you for listening.